All right, we'll call this December ARB meeting to order. Roll call, please.
Chief Thornton.
Here.
Chief Allen.
Here.
Jennifer Hempling. Here. Lillian Pike. Here. Dee Dee Hayes. Diane Chief Phillips.
All right. First item on our agenda is the approval of minutes from the November 2021. Those were emailed out to you, and everybody should have had time to read over them. Is there any questions or changes or anything anybody sees we need to make on those? All right, do I have a motion to accept?
So moved.
Second.
Lily Pike is motion and Chief Allen seconds.
Okay.
Roll call, please.
Chief Allen.
Aye.
Hempling.
Aye.
Pike.
Aye.
Motion carried. On the old business, we still have on first response mileage on the trucks. David, will you, Jason, like to address that?
Chief, yes.
Could you come to the microphone, please? Thank you.
Good afternoon. David
afternoon.
Childers here with First Response Ambulance. We have purchased 2 additional units, and we have paid our permit fees for our units and submitted those to the city clerk, and we're awaiting inspection.
All right, thank you.
Thank you.
So you'll have a total of 4 units, that's correct?
Affirmative, sir.
Is that 2 brand new units or 2 newer units to you? When I say new units, I mean with 0 miles on them, or brand new units, or just new units?
Yes, sir. Good question, sir. We bought these units from a government entity. One is, both of them in North Carolina. They were fire-based units. They are used units, and we're waiting on production, hopefully in 2022 with Demirs to start back production to maybe go into the type 2 units. These are type 3 larger box units.
Good luck. We waiting on units for police cars too.
Yes, sir. I understand. Thank you, sir.
Thank you.
All right, new business is penalty provision for refusal to supply information.
That's technically, rather than a penalty provision, it's an amendment of the code section that deals with that, in keeping with the direction of the board last month. I've done an amendment. It's set out on what you got. I've put in bold what's being added. It's just after ambulance regulatory board in both sections of paragraph V, added or EMS coordinator, and that was the only change. And if I know y'all voted to do it this way last time, but if you approve this, then I'll introduce it to the council.
Do I have a motion to approve this?
So moved.
Pike moved. Do I have a second?
I'm still trying to read over it. Are we gonna open it up for discussion? Okay, I second it.
Chief Allen, seconds. Is there any discussion?
There is, but I'm trying to figure out what it is. What does it say there, Chip? What is it really saying?
But the ordinance originally written said that it was a violation to, and this is in the section of the code that deals with criminal charges. And the reason for that is that the misrepresentations and failures to respond and operating without a license and all those things that are included in A through V can be CPNC holders or not CPNC holders. So that's why it all comes under that heading as opposed to some other operational heading. And what the ordinance said before was that anybody who makes a false representation to the ARB or fails to respond to questions from the ARB would be guilty of this. I don't remember if you were here last month, but the issue had come up repeatedly that questions were being asked and were not being answered. The only recourse with the ordinance as it was written was to wait to the next ARB meeting for the EMS coordinator to ask the ARB board to ask the question, and then if it was not answered, at the next ARB meeting, act on the refusal to answer. What this does is keeps the EMS coordinator from having to ask the ARB to re-ask the question. They can just ask it up front.
What's the consequences?
It's treated as a Class B misdemeanor, like everything else in that section. So up to 180 days in jail and up to a $500 fine.
Okay, it says provide any information requested. What if we ask questions that's not pertinent to the board or the EMS coordinator or really much the job, such as, what's your financial statements? How much money you grossed for last year?
It has to be relevant to in any proceeding or transaction, which is anything that's going on that is in the purview of the ARB. It's not wide open.
Okay, but it says not limited to. Would that still, it would be limited to?
Right. It would be the police department, the magistrate's office, and the ARB, and the EMS coordinator's discretion. And if there was any discussion with legal questions that weren't pertinent, would be we would recommend against any pursuit of that.
Gotcha. Okay.
Is there any other discussion?
No, sir.
All right. Roll call, please.
Allen,
Aye.
Heffling,
Aye.
Pike.
Aye.
Motion passed. Chief Phillips, could you give us a report on the proposed response plan, what we've got done with that so far? Chief Phillips. The proposed response plan that Decatur Morgan asked for last month, that we did together with Decatur Morgan and First Response.
We have not moved forward with the advanced trucks yet. But we're working with, Tyler was going to work with the study on an advanced scope of practice pilot program. And with the holidays and all, we have not followed everything on that. And so we were pushing that till after the first of the year to move forward with the
All right.
plan for the advanced trucks.
When you do that, please set that up with Decatur Morgan and First Response both, to have input, and 911 also, since they'll be the ones that's, would be dispatching anything like that, so.
Mhm.
You plan on doing that after the first of the year sometime? All right. All right, Chief Phillips, will you present the proposed plan update, response plan update? That's what you was wanting to get to.
That's
first.
what I was wanting to get to now.
I just wanted you to sit down and stand.
Yeah, you just, like, I need to exercise. It's not enough distance between my room and the copier anyway.
I passed it out. I passed it out. Save you some steps.
So what we have is the response plan that was adopted. Sorry, Chief, refresh my memory, the date in October. And we made some, we've modified it to add section 4. The ordinance outlines the purpose for having the response plan is to ensure that when we have multiple providers, that no one service is more or less active in emergency response. So section 4 there is an attempt to ensure that we're balancing out between the city and both providers a balanced delivery of service. So to Section 4 to ensure that no one provider is more or less active in emergency responses, help ensure proper response to ALS calls, and reduce the occurrences of road calls. Each provider shall maintain the following minimum unit staffing requirements. So what I've drafted is 2 24-hour ALS 7-day-a-week trucks and 1 12-hour ALS 7-day-a-week truck. And I will open that up to discussion to the ARB because there is room for discussion there. We can discuss that and then move on to C&D, or we can cover C&D if you want.
Just go ahead and do all of it.
Okay. And then for C, before a non-emergency transfer may be assigned to a unit, it must first be assured that that service will have at least one ALS unit available for answering an emergency call after that unit has been dispatched. And then D, no EMS unit that has been in service, just completed a call or other assignment, may go out of service if the city has no available ambulances at that time. These first three are very similar to some standards that were in place previously back when First Response and DMZ were operating simultaneously in the city. It worked out well under that system, and we had very little problems during that time period, and we actually saw excellent response times and coverage on our frac tiles. The D is to address a situation that we've seen a little more recently, to where we are zeroing out on ambulances a little more commonly, and we just want to make sure that we don't have crews going off duty while there's currently no other ambulances available to answer 911 calls.
So just to be clear, the entire front page, 1, 2, 3, and all the way down to number 4 is what we're currently doing. So
Correct.
nothing changed on any of that stuff.
Nothing
The
has
only
changed.
thing that we've added is number 4, which gives a minimum number of trucks that need to be in service each day by each EMS agency. And then C says that to run a non-emergency transfer, you have to have an ALS truck available to run 911 calls. D, you can't go out of service if there's no other trucks available in the city. That's the only changes that's being made.
Correct.
So how did you get these numbers of, where did you come up with the numbers of 2 24-hour trucks and 1 12-hour truck? And is there a time that 12-hour truck needs to be run?
So, sat down and did a study. Unfortunately, we weren't really able to pull the data out of CAD to see how many trucks are available through a time span. So it was a manual dissemination of data to look at how many trucks were logged into CAD per day, per hour, per incident, per minute. It was a rather lengthy process. So to do so, what we did was we chose a 7-day span across 3 separate months. We chose May of 2021 because it was the month with the least road calls of 2021. We chose September of 2021 because it was the month with the most road calls. And we chose November of 2021 because it was the month with 2 services operating. We went through doing the best we could to interpret the raw data out of CAD of how the units were logged in, and determine the number of hours that a truck was operated, that we had ambulance coverages in the city on those days. We counted the number of ambulance calls there were during those days, the number of road calls there were during those days, and came back out with a figure that averaged out to roughly 6 for a 24-hour period. We know that by looking at the data that we don't run that many calls between midnight and 6 a.m. And I have all these numbers available if you're interested. You know, between midnight and 6 a.m., we ran roughly 15, 16, 20% of our calls for the third quarter of 2021. So we know that there would be no need to have the full 6 trucks that those hours calculated added in. So that's why we determined that a 12-hour truck would probably be most advantageous. I personally feel that 2 12-hour trucks would be the answer. When you break down our times of calls by the hour, in the third quarter of this year, we ran 2,839 calls between 6 a.m. and 6 p.m. and 2,930 calls between 8 a.m. and 8 p.m. 2,700 between 10 a.m. and 10 p.m. and 2,200 between 12 noon and 12 midnight. So obviously between 6 and 6 and 8 and 8 are the time frames with the most call volume. And I think that the city would support 2 12-hour trucks per service during that time frame. Probably not ALS trucks. I think we would be sufficient with 1 12-hour ALS and 1 12-hour BLS. But I do feel comfortable because this is a document that is recommended by Chief Thornton and myself and amended by this board, that we can make this recommendation here today, and let's look at what the data does for the next few months, and we can come back in February and make a modification if needed. Now, whether we want to make that modification up or down in February is up to us. But I'm confident in this board's decision either way.
So, let me sit and sum up what you said. You went through all the calls, looked at the number of hours trucks were in service, different times during the day, and come out with an average, and you think that if we ran 2 24-hour trucks 7 days a week and 1 12-hour ALS truck during those peak hours by 2 services, that would be sufficient? And if not, we can reevaluate.
I think it would be enough of an improvement that the 2 services could at that point control their own business and adjust their extra trucks as needed. I think that would be as minimum the amount of oversight as this committee could put to ensure that we're getting the adequate coverage. Because we're in the third quarter we rolled 310 calls.
Third quarter of
2021.
So the last.
So July, August, and September, we rolled 310 calls. And now something else to bear in mind, we have a pretty robust triage system, call take system at the dispatch center. And those road calls do not take into account the number of times that a basic level truck was sent to an advanced level call, which happens on a regular basis as well, which I think we should start taking into account, because that's a patient that, although they are getting a ride to the hospital, they're not getting the pre-hospital care that it's been determined they needed.
You get any idea how many BLS trucks were sent to ALS calls?
I have not filtered those numbers.
I have a concern about D.
All right, you got any questions or anything?
You say something about D, ma'am?
I do, I have a concern about D.
Okay.
where you have the statement that no EMS units that has been in service, just completed a call or other assignments may go out of service unless there's another ambulance there at the time. Is there going to be a stipulation that for decon considerations, I mean, if you're down to one truck and you've got one bloody truck, to keep it in service? I understand not wanting to go out of service because you need them to respond quickly. However, that will immediately builds in a penalization for an extended time to get to the call if they're having to decon before they roll.
Well, obviously, you know, the truck has the need to decon to go back in service, which can be done at both of the hospitals. What we're mostly concerned with is we've had several situations where crews have gone off duty because it was quitting time. So that is our main concern. Or, you know, we may have crews that are just wanting to go back to the office to pick up extra supplies. And we have 911 calls that are not being answered. That we have an ambulance coming from Coleman to a 911 emergency call, and there is 2 people in an ambulance in Decatur that just don't want to respond to that call. So that's, and Chief Thornton, to add to the paragraph under section 4 was an addition as well, but that's just a housekeeping note.
Are you saying that during any 24-hour period, we would have 4 ALS vehicles in service at any given time within 24 hours between the 2 providers?
Crews working, yes, sir.
Okay, and that's,
Should be 4 to 6 according to your peak hours.
yeah, if during the peak hours you have 2 more, so it could be up at 6 ALS trucks working. That means 3 per provider.
Yes, sir.
What about BLS trucks? Would there also be BLS trucks? Those are all ALS trucks. You gotta have 3 ALS trucks per provider, plus any BLS trucks per provider?
That would be up to the providers to determine those needs themselves.
Okay.
There are plenty of needs for those as well. As I said, I don't think these 6 trucks meet the needs of the city, so there's room to adjust for additional 12-hour, 8-hour trucks. There's days of the weeks when the call volume is greater due to non-emergency transfers such as dialysis patients and such. So those days of the week she would schedule extra trucks and such.
Okay. C, before a non-emergency transfer may be assigned, is that assigned from 911
Or the service,
or what service?
the provider.
So you're saying the provider can't even take their own calls if it comes into the provider?
Unless they have at least one available ALS unit.
How would you know?
The dispatchers,
They don't, I didn't think they sent private calls that the provider gets through dispatch.
currently 911 is still dispatching all the calls, correct? Now, the providers will ask the dispatchers, they keep up with their scheduled times pretty well. Some of the non-emergency stuff is pretty routine and scheduled. So it's a regular communication back and forth, and it's not uncommon for the on-duty supervisor to ask the dispatcher to put a truck on a call to go pick someone up at, say, the dialysis center and take them back home. And sometimes when that happens, that truck may be the only truck that's available to take a 911 call. And by doing so, you've taken a non-emergency truck out of service that could have responded to an emergency to handle a non-emergency call.
I think we all agree that we need to have at least four ALS trucks citywide at any given time, with an extra 2 on. I think that's a really, really good idea. I guess I'm confused on how the dispatcher keeps up with all the calls that each provider run that's not emergency.
They issue them out.
They issue all the calls?
Yes,
They
sir.
shouldn't run a call that dispatch don't send them on.
here's my 2 cents worth of no knowledge. I thought first response could dispatch some of their own things to go out and go. In the hospital, don't do it either. So the hospitals can't run a call from hospital to hospital without telling you at 911. Is that accurate too? See, I've learned something. I don't know. When I stick on the police side.
Hey, just to
Chief, if I
clarify,
can-
just to
if I
clarify
can-
what he
go
said.
ahead.
You ask, every call that goes out of the hospital, y'all call the 911 center. It sounded almost like it was something else said on that. I just want to make sure we was all.
Okay, yeah, that's what I understood too. And I did not know that. I didn't know Jenny did all of it. Okay.
And Chief, the reason when we drafted this, it was so they wouldn't get lost in the shuffle, that there was one point that knew everything that was going on, and that's
It
why.
makes sense to me, yes,
Yeah.
as long as it's all going through there, okay.
So if a citizen calls first response or the hospital directly, y'all are gonna turn around and call 911 to let them know that you're going out on call, like a still alarm? Okay.
If I'm not mistaken, we had the same issue, Mr. Childers, when y'all was working with, Dempsey. And we had, I think Dempsey had their numbers on their truck, didn't he, at one time? And we had to make them stop, do not call them directly, it's a 911 and they disperse out all the calls. It's been that way ever since
To
then.
keep it fair
Right.
across.
And gives us an idea, like, it would be impossible for Mr. Childers and Mr. Stinson to, know what the other one's doing. Like, when dispatch puts the calls out, sometimes they'll have calls holding that they need to go on, and if they're just running calls as they get them, it messes up the whole system. It makes it confusing for the system.
I was still a little bit confused in her question about the decom. If a unit is out of service, it can't leave, and if that's the last unit, go decon. Kind of explain that to me again, 'cause
So-
you got me here confused on that one.
So it's not that they can't go out of service to clean their truck, it's just that they can't in their duty, in their shift, or not take a call.
They can't leave the city open, is what you said,
Correct.
but with no EMS service.
Yes.
Yes, okay.
Just, I'll throw this out here too, in some of the discussion we had with this. I worked on the ambulance for 20 years. And there never was a time that I couldn't do a quick decon of the truck and get it back. I know you'd said something about that. We carry all kind of cleaners, both services carry wipes, sprays, towels. The truck can be wiped out, cleaned out, and deconned when the patient's pulled out of the yard. It would need some more fine decon, more where they work harder and do a better, make sure everything is really wiped down. Yes, they will need that sometimes, but there should be stuff on the truck always to decon any call that you get. Is any other discussion? Has anybody else got, Mr. Childers?
Board members, just to add a little history to this, the 24-hour trucks, that was implemented by Chief McKelvey when he was here. One vitally important thing that's missing out of here, among a couple of others, is also at that time there was what we called BLS week. Every other week, you were responsible for all the discharges out of the hospital, all the transfers. That facilitated the revenue to produce the two 24-hour ALS units, okay? There's no mention of a BLS week in here. This is identical. I can show you a document that's just almost identical to this that was produced in 2012. So there's no BLS week now. And to say that a service has to have maintained two 24-hour trucks and a 12-hour truck within the city without assuring revenue on transfers and discharges is a death sentence to that service. Just on the other thing that rears out at this, Again, Section D, that you guys had brought up about going out of service. The Alabama Department of Public Health, if a unit runs a call and depletes its mandatory supply that is required by the Alabama Department of Public Health, it is illegal for them to respond to another call until such time as they become in compliance with the Alabama Department of Health equipment list. So I think quite possibly maybe you could do some changes to that one to make it fit, but just on the legal end of it, it is illegal to operate a ambulance and respond to a call knowing that you do not have the state mandated equipment.
Which section is that?
In the state rule,
No, on the section on this.
D, sir, number
D.
4D. And again, I implore you to look at the mandates of 2 24-hour trucks, 7 days a week, and a 12-hour truck. If you don't have a BLS week to produce your revenue, you're not going to be able to have your payroll for the 2 24-hour trucks and the 12-hour truck. That is our standpoint on it.
I got a question. You've been in EMS for years. How often do you run out of supplies on your truck?
It depends on what supply you're talking about, and also it varies on the number of patients you had. If it was an MVA with multiple patients, or if it was a cardiac call where you depleted your epinephrine or you depleted your defibrillation pads, there's different variables.
I think, I mean, I agree with you. There is times, but the times that you run out of a truck that's stocked the way it should be, that you run out from running normal calls is very slim. The purpose of D was not for people not having supplies and being able to run it, or a truck to be a contaminated mess and to keep running. We've gotten away from what this is. This is from when, what come about with this is having units that refuse to run a call because of issues other than that. And that's the whole reason D come about, is trying to, having something happen where we had a truck coming and responding from Coleman, while we had a truck in the city that refused to take the call. Not because of decon, not because of being out of drugs. That's what it was. The BLS week that you spoke about, that you done a while back, so 4 weeks in a month, what you're saying is you would be able to run all the BLS calls 1 week, and then Decatur Morgan the next week, and you the next week. So basically you take half a month each, right?
That's the way it was at the
When you would first, when
inception.
DMZ was doing this,
2012, yes, sir.
right? So basically you got half the calls, right?
Yes, sir.
So that's really what we're doing with what the program is now with 2 ambulance services. Shouldn't you have, if you both have 2 24 and 1 12-hour truck, both of you got 3 trucks, shouldn't you be able to run the same amount of calls at what the other ambulance service is? Shouldn't they just be split?
No, sir.
And one last thing before you answer that.
Yes, sir.
You talked about the 2, it wasn't financially, you didn't know about financially about the 2 24 and 1 12-hour truck. Back when we had discussions about CP&C, both for you and Decatur Morgan, you told us that you felt 5 to 6 trucks would be sufficient to run the city. Jeannie said the same thing, and so did Decatur Morgan. So that's basically the same number of what all of you agreed upon when we was talking about running for the CP&C.
And Chief, I would submit to you as this. When there was a BLS week, 911 was called from either hospital, and they knew which week it was for which provider, and they would dispatch that provider, okay? Those were all the non-emergencies unless they were your dialysis patients or you had a contract with that certain facility, okay? That is not the case now.
So you're saying during BLS week, that even if it was your week, you could still run BLS calls with some other entities?
Yes, actually the way it was at that point in time, BLS week was you got the transfers and the discharges out of the hospital, and there was also a timer. If you could not make that transfer within 45 minutes, then they could roll it to DMZ at that point in time when they were here. So there was a safety net. If you were busy, there was still that safety net. So at that point in time,
So DMZ would have to, and you would have to, on your non-BLS weeks, staff ambulances? You'd have to pay staff on ambulances?
on the non-BLS week, we would still operate 2 24-hour trucks. And then if we had any appointments that we made through our office or any patient appointments made directly through our office and we forwarded them to 911, we would operate on those as well. Now, first response, we do our transports on the 911 side, as well as if we have a contract with the facility, we do those transports. Other than that, there's no other transports that we're able to do. So to say that if you have 2 24-hour ALS trucks that you're going to get half the calls, that is inaccurate. There's no way that you can project that you're going to get half the calls. You may get half of the 911 calls depending on where your trucks are. You may get half of those. You may not. However, you have to have the revenue to facilitate the 2 24-hour trucks. And if you take those 2 24-hour ALS trucks and you operate those in the fashion that this is describing and what I've heard today of responding to 911s, you're not going to produce the revenue to pay your employees for the cost of the 2 24-hour ALS trucks. You pay for your 911 employees by operating your non-emergency trucks for your discharges and your transfers between hospitals, facilities. At this point in time, I think the original plan, Mr. England, that was the EMS coordinator during the CPNC process, addressed you guys as well as the city council that the plan on the non-emergency was there was going to be patient preference forms and things of this nature. However, there seemed to have been a switch flipped and nobody wants to go with first response now. It leaves the hospital. So whether that's accurate or not, that's just the case at this point in time. We feel that this Pandora's box was opened by this ARB as well as the city council, and to mandate any more and to damage any more either company is unnecessary at this time.
Just one last question. You just said that financially you couldn't do it would hurt your company, the two 24-hour trucks each day and the 1 12-hour. You just said that it would financially hurt your company to do that.
Correct.
So that's basically 2.5 trucks a day, which is, you originally said 5 to 6.
That's when you're getting all of the calls. Ms. Ferris, we have the video of Ms. Ferris to this ARB, as well as the city council saying that 5 trucks, and that's what historically we've ran 5 to 6 trucks when we're the only provider. When you're talking about 5 to 6 trucks and you have all the calls, yes, you're able to produce the revenue. If you have 2 24-hour trucks and you're not doing the non-emergency transfers and discharges, you still cannot support 2 24-hour trucks off of 911.
All right, I was wrong. I got one more question. The reason we did this is because of the number of road calls, and as Chief Phillips has said, in the third quarter of 21, we had 310 road calls.
Yes, sir.
if you want to cut this number down even less than what it is right here on this, I mean, that would be like you running 2 trucks. How are we gonna prevent, I mean, that's even less than what we're doing now, because I know first response is, each day their number of trucks is, not first response, Decatur, Morgan, their number of trucks are higher on duty than what yours are by looking at what the CAD shows. If we cut those numbers down even less, how are we gonna prevent the roll calls and getting people to times, on their calls on time?
Sure.
And we'll go over here in just a little bit, I think, some of the times, I'm not sure because of Samantha being sick, but we do have times from previous months showing that fractal times are not being met. So if we cut those numbers down even more, how are we gonna meet those fractal times, and how are we gonna prevent calls being rolled?
Good question. I'll address that one first. If you don't have the revenue to put up the units, to pay for the units, then you don't operate the units. It's simple. You don't have your officers, you don't put 30 officers on a shift knowing that your budget's only for 10 officers because somebody's gonna be unhappy before the end of the payroll. It's the same thing in the private sector. Mr. Phillips, just before you came as the director or coordinator, this 310 rolled calls is an skewed number at best. We have
You're right, because you have to add on the BLS trucks that were sent to ALS.
And,
calls, so
and
that
also how
number's
many,
even higher.
exactly, and also all the recordings of a truck being sent to a call, which a BLS truck going to a call is not against your ordinances, and then having an entity within the city contacting 911 via the radio saying, send the hospital unit, they have one available. This was prior to the CPNC being issued. This 310 calls is an erroneous number. It's just not accurate at all. Not accurate at all. Again, back to the point at hand. You can't mandate X number of trucks if the revenue is not there to support the X number of trucks.
So how many trucks do you have that meet the criteria right now?
We will have 4.
4. So you'll need to have 3, and then you'll have 1 extra.
Well, but I'm talking about revenue, not exactly the actual truck unit, okay? With the call volume that we're transporting at this point in time, will not support 2 24-hour ALS trucks and a 12-hour BLS truck.
So basically, you're saying that you can't operate this because of revenue income. That would be probably for you and Decatur Morgan?
No, it would not be for them because they're getting 100% of the transfers and discharges out of their own facilities. That's where this is a convoluted mess.
Is that accurate?
No, they're getting everything that goes to River City or Decatur healthcare out of our facility, so that's not correct. We're not getting 100%.
Not 100%, but if we look back at the numbers, which we can, that would probably be going back to the facilities that Tyler had mentioned. That would probably be maybe 10 calls a week.
Can I address this since it's a
Please.
system issue?
I need to stay up here.
This is the worksheet I used to, where I referenced the numbers I studied over the 6 days. And what I want to direct on Mr. Childers' comments, because as EMS coordinator, it's my job to oversee the system as a whole, which would include both services and how their performance is. So if you look in the top box, that is May of 2021. Third row down says medical transports. So in our business, the date of the month is less important than the day of the week. So although we did compare the same dates, I mirrored them over the day of the week rather than the date of the month. But you can see on Monday 12, Tuesday 19, Wednesday 17, Thursday 20, 15, 15, and 8. If you look down to September.
Chief Phillips.
Yes,
The
sir.
reason you did that month in May was because it was the lowest amount of roll calls?
Yes, sir. in September, and there was only one CPNC provider at that time. In September, there were 13, 20, 19, 20, 21, 13, and 4. So if you compare those 2 months, those numbers statistically are just almost irrelevant. If you look on down to November and you compare Decatur Morgan's medical transports with first response medical transports, Decatur Morgan had 10, first response had 12, Decatur Morgan had 15, first response had 10, Decatur Morgan had 13, first response had 8, Decatur Morgan had 19, first response had 11, Decatur Morgan had 12, first response had 8. So statistically, I don't see the numbers adding up to Mr. Childers' arguments. Sorry, medical transports here, 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 and here. Also, addressing the call volume as well. You can see for November, it does address the total calls per day. So first response, for example, 21 calls per day, Decatur Morgan 20, 22 and 22, 24 and 23, 28 and 29, 21 and 32, 22 and 26, 5 and 21. If you want to compare, for example, the day that first response only ran 5 calls and Decatur Morgan ran 21, that's because Decatur Morgan put in 96 hours of ambulance coverage and first response only put in 56. So the less hours of ambulances you have on the road, the less likelihood you are of catching 911 calls. So,
Are the medical transports a transport of a 911 call?
no, sir, those are non-emergency transfers. Is there any other questions I can ask related to this data?
I don't have any.
Can someone call in on the radio and say send first response or Decatur Morgan? Okay, it has to go through 911. 911 would say next up. They would pick whichever next one.
Any emergency call for service is closest AVL unit.
Which is determined still through 911.
Yes, sir.
Okay, because I keep hearing that. I think he just mentioned today that someone calls in and says send Decatur Morgan instead of.
Can you address what happened on that?
Yeah, I'm
day?
sorry, I keep forgetting about my friend. Yes, sir, any emergency call for service is still the closest GPS located unit. The only exemption to is a medical transfer, which is when the patient has a contractual agreement with a particular provider. And then the provider has to provide that contractual agreement. The patient or the facility that is hosting that patient has a contract, and then they provide that contract to Morgan County 911, and then that contract is adhered to by the dispatcher.
All right, so to rein all this back in, what's being proposed today is the 2-page paper that Chief Phillips gave you earlier, where we're adding number 4 to that list.
Can I ask
dispatch
Chip a
response?
question on that one? It seems like the biggest concern is the go out of service statement. If he's talking about you can't go out of service, Chip, if you have to go out of service to restock or something of that nature, can we say some other language instead of may not go out of service, like at the end of the day, but not to restock, some way to clear up the language and just say, because it says go out of service, period.
There may be a term that EMS uses that means I'm shutting down for the day.
Yes, that's what
But
I'm
I
asking.
don't know if y'all have a term for that.
Yes, out of service is the routine terminology. I agree with Chief Thornton. I'm relatively new to the EMS. I've only been doing it 26 years. So, so I've never really had a time when my ambulance was so depleted of supplies that I could not run one more call. But as ARB, Chief Thornton and myself, to address Mr. Childers' concerns, We have the ability to determine what supplies are carried on the ambulance, so an easy thing to do is just double the amount of supplies we require an ambulance to carry in the city, and that way we don't have to worry about that ambulance ever dropping below the state mandated number of disposables. Disposables are relatively cheap in the grand scheme of medicine. You can stock an ambulance relatively cheap with IV catheters and gauze and so on and so forth. It's really not, you know, you're not talking about a huge expense. If you said we were going to carry 10 IV catheters instead of 5, you know, if that solved the problem of crews depleting down below state level to where they were breaking a law, then we could just say in the city of Decatur, we're going to say 10 instead of 5. But we've always mirrored what the state said because the state seems to think that works well all over everywhere else, so why wouldn't it work in Decatur?
All right. I think we had a lot of discussion from both sides on this. I guess at this step, we need a motion on it to approve this.
The code calls for these requirements to be put in by the EMS coordinator and the police chief with the concurrence of the ARB. So it would be that the motion would be to agree to or concur with the requirements that the two of y'all have recommended.
All right. Do we have a motion to agree with what these stipulations are on this?
I move.
All right. Chief Allen moves. Do I have a second? Ms. Pickett, second. Roll call, please.
Allen,
Aye.
Hempling,
Aye.
Pike.
Aye.
Motion carried. All right, Chief Phillips, do we have times?
We do not have official times for Decatur Fire or the services.
Yeah, Decatur Fire.
We do not have official times as ordinance says by.
Sorry, keep getting the microphone. So yes, as with Samantha sick, and we're hoping she gets better soon, we did not get the official 911 times, but just out of Decatur Fire's RMS system. So we ran 436 calls it was. We had a 96% fractile under 8 minutes. And in the PJ, we had a 100% because of 8 calls under 13.
Okay.
And I have the one other, the assessment.
Do y'all have any times that you got from your record system?
I don't have any times out for calls, I mean,
Don't have times? Okay, all right. All right, Chief Phillips.
Continuing on with the EMS coordinator's report, I'm sorry, Chip.
I've got it all committed to memory. So. Thanks.
Chip, as you're looking at that, is that? What point does that fall under?
This what?
Is that public record now or after approval?
After you offer it.
So we have one minor occurrence on December 6th. We had a situation to where Central Dispatch was attempting to contact a Decatur Morgan unit supervisor, at which point the one of the crews said there was no supervisor on duty. I contacted Tyler, and he said that the supervisor had called off sick that day, and there was a lot going on, and they had not, there had been a mix-up in communications, and no one had picked up that role to carry out the field supervisor duty of the day. As you know, 320D says each provider shall ensure that at least one field supervisor with EMS experience is on duty at all times to oversee and provide support to field personnel. Violation of this provision will result in a 1-point assessment. So I'm gonna just recommend, even though it's a minor infraction and somewhat of a misunderstanding, that Decatur Morgan ambulance be assessed 1 point for failure to comply with 320D.
I have a motion.
So moved.
Got a motion and by Chief Allen, second by Ms. Pike. Is any discussion? Roll call, please.
Allen,
Aye.
Heffling,
Aye.
Pike.
Aye.
Motion carried. I just wanted to touch on the discipline reviews to, I'm sure everybody has already heard, but, the fourth quarter penalty that was, applied to, first response, was not supported by council, unanimous vote by council. So, the $5,000 financial penalty was not applied to, first response, and it was taken off. Does anybody have any further? Nobody any further? All right, if there's no further, next meeting will be January 11th, 2 o'clock, council chambers. Meeting is adjourned at